Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we've got a great little lesson on how to change your walking mechanics to decrease the forces that aggravate your lower back spondylolisthesis pain. Hope you enjoy. So keep in mind with walking, your RPI, which is your reverse posture isometric, that locks your spine into the most neutral spine position or safe position. If you don't know what that is, go to either the Posture Size or the Pain Free and Fit websites. We have a free body analysis there. You need to make sure that you're checking and resisting your typical tendencies of, let's say, hip hiking with one hip up, torso or rotational discrepancies that aggravate through asymmetrical contractions, the spinal segment that has the spondylolisthesis. You want to make sure your multifidi muscles, your transverse abdominis, and your obliques are all working correctly. If not, you're creating an asymmetrical force on the spine that when you walk is only going to irritate it. That being said, once you have your neutral spine stability locked in, you want to keep the following tips in mind as you're walking, because we walk more than any other activity during the day except breathing. And if we take 5,000 steps on average with each foot a day, that's up to 640 tons possibly of load or stress being absorbed by the body. We don't want to have a dysfunctional or asymmetrical posture in our pelvis or our lower back or rib cage that then is going to aggravate our spondylolisthesis segment, irritating disc fibers, ligaments, associated muscles, facet joints. You want to make sure you're as symmetrical as possible. When we take a step forward, we want to make sure that the heel is stepping with a little bit more of a turn so that it's facing inwards. And the reason for this is part of the shock absorbing system of the body. If I hit with a heel that had an equal amount of pressure from the inside edge to the outside edge, I'd lose that ability for the heel to come down and absorb some of the weight and shock that I'm putting into my leg, and then that's being transferred up into my lower back. So I want to make sure that if I'm using heel strike, I'm using the outside of the heel to contact first, and as I bear weight and bring my weight over the heel and the foot in what we call mid stance, I want to make sure that I don't go too far into pronation. Pronation is where I put more weight on the inside of my heel than the outside. If you have a tendency to pronate, or if you have what's known as a rear foot or heel varus deformity, where your calcaneus or heel is actually shaped so that it tilts more inwards naturally, you want to make sure you have either some type of orthotic support or varus wedge to prevent that inner heel, when it does come down at mid-stance and you're approaching mid-stance, from going too far into pronation. Because if it does, and that foot actually leans in too much, the knee is going to follow, and it's going to torque the pelvis and the lower back, putting stress at the spondylolisthesis. The heel is also great for absorbing shock because it has a fat pad underneath it that absorbs a lot of shock. So for those of you without any heel spurs or problems, we prefer to land with the heel on the outer edge, and as I come into bearing weight on the foot, I want to make sure I keep a little bit of bend to the knee. If your knee is too straight as you're walking, you're going to lose one of the body's primary ways of decreasing shock and stress from being transferred from the foot, from the contact with the floor, up into your spine. So you want to make sure the knee is a little bent. That allows the quadricep or thigh muscle to absorb some of this force through what's called an eccentric contraction, which is a lengthening contraction, as we absorb weight down into the foot. As you're stepping forward into that first step, make sure that you're avoiding an anterior malposition of the hip. A lot of people with spondylolisthesis, because they have an anterior pelvis where the pubic bone is lower than the tailbone, have a tendency to overuse their hip flexors at the expense of their buttock or glute muscles. And that creates a forward slide of the thigh bone in the socket, known as a femoral anterior glide or anterior hip malposition. And that creates an abnormal mechanical stress on the hip that shortens those hip flexors and contributes to that anterior pelvis, which then increases the arch and compresses the back of the spondylolisthesis segment. So we want to make sure that as we're stepping forward, we're using glute or buttock activity to move that thigh bone back in the socket as our hip flexes and as we step forward. That creates a more balanced, stable hip joint, avoiding those overactive hip flexors. We also want to, as we're stepping forward, allow our pelvis to rotate for that forward step. This is also one of the prime ways that we decrease forces that are coming up from the ground contact into our spine. As we make contact with the ground, that moving of the pelvis backwards helps to dissipate a lot of those forces, so it's absorbed in our upper leg and pelvic area and doesn't make it into the lower back. So we want to keep all of these factors in mind as we're walking, and the way to practice this is in slow motion at home. If you need to hold on to something while you practice that step of hip back, a little bit of tail under if you do have an anterior pelvis, all your RPI muscles and neutral spine positions are engaged, and you're practicing using the glute to move the hip bone back in the socket, rotating the pelvis forward. That's not allowing the leg to slide forward in the hip socket, but the whole pelvis as a ring from right to left rotates, so the pubic bone's going a little bit to the left in this case, and that leg comes back in the socket. The heel is inverted, meaning the outer edge is hitting on the heel, and I'm going to move into, with a slightly bent leg, into a mid position of stance. From this position, the biggest mistake that happens is that I'm going to hip hike, where the hip moves up once I move into this mid-phase stance, and the rib is going to come down. That's going to compress the spondylolisthesis segment on one side, aggravating it, or overstretch it on the other. So as I make contact with the ground and my weight comes over my foot, I want to make sure that hip is held down, avoiding hip hiking, and the rib is held up so I'm tall as I transfer weight onto that foot, not short and compressing the area. And the last segment of walking is once I pass that point of mid-stance, I'm going to be using my buttock to push backwards to take my next step forward. If that buttock contraction is not associated with tail under tension, what's going to happen is as I push off at that foot, my lower back is going to arch right there. And the tail is going to come up, pubic bone is going to go down. Again, we're going to be creating too much of an arch in the lower back. That's going to compress the spondylolisthesis segment, and that's also going to irritate. So once you transfer your weight from mid-stance and push back, your foot's actually going to lean a little bit more on the inside ball of your foot, the ball behind the great toe, and you're going to maintain tail under tension and purposely squeeze that buttock while maintaining tail under tension so that you don't overarch the back and overutilize lower back muscles, sparing your spondylolisthesis from pain. Take these tips, plug them into a slow practice, slow motion practice, and then install them into your walking throughout the day. You will find that it will be much more demanding on your muscles. You're going to burn a lot more calories. You're going to be using a lot more hip muscles, a lot more buttock muscles, but it's going to spare the lower back from stress. Remember, the walking pattern is supposed to be the lower back is tight, it's stable, it's neutral. The leg is loose so it can absorb more shock, so we have more of a motion and a shock absorbing, decreasing the stress into our lower back from the leg while the lower back remains stable and avoids hip hiking, it avoids twisting, it avoids overarching the back and extension. So plug that in, see if it helps with your pain with walking. It certainly will help to improve many mechanical aberrations that happen that can create spondylolisthesis pain, and I'm sure that your spondylolisthesis, lower back pain, will be helped with these walking tips. If you like this video and would like to learn more about spondylolisthesis and healing exercises, feel free to subscribe to our channel. We got a lot of great videos there. Any questions or comments, write them in. It gives me the seeds of ideas to do our future videos. If you're looking for a nice program of a lot of other exercises to strengthen your core, stimulate your healing process for spondylolisthesis, check out our Fast Track Spondylolisthesis program available at the painfreeandfit.com website. We've got stretches, pain relief exercises, strengthening and conditioning exercises, nutrition, exercises, and techniques to get you back into your sports activities and daily activities without pain by strengthening the stability and the healing mechanism for your spondylolisthesis. Hope you enjoyed these walking tips, and I hope it helps you with your lower back spondylolisthesis pain.